Over the last few months, I have discussed the role of 5G in different industries as part of various projects. Some of these discussions are part of my blog posts, while others aren't. In this presentation, I want to explore the role of not just 5G but other connectivity options for healthcare. In addition, I will talk about the role of smartphones and wearables in healthcare. For people who may not know, 3G 4G is a consulting and training company specialized in mobile telecom sector. We work for a selected few clients looking at future technology and its impacts, policies and regulations associated with the technology, and how to make sure the technology is beneficial not just for end users but also for the society in general. We have been around for nearly 20 years. We now have many different brands, as you can see here. And surely you have come across some of them while searching or on Facebook, Twitter or LinkedIn. Hopefully you are watching this video on one of our channels. We regularly share ideas, vision, presentations and other sources of information. Please follow us on LinkedIn or Twitter to keep up to date. Before we proceed, I want to share one of my favorite 5G advert on healthcare from Telecom Italia. People have been writing about how 5G will enable remote surgery for years, so Telecom Italia went ahead and made an advert of that. Personally, I don't believe we will see remote surgery as such, but there will be a lot of remote assisted surgeries or consultations. You have most likely seen this picture in my presentations. Basically, what I say is that instead of lumping everything in a mobile generation like 5G or 6G, we should divide the technology in three parts. You have the network, the connectivity, and the devices. Then you have applications that run on top of this ecosystem. So let us start by looking at the connectivity first. There are different connectivity options used in different scenarios. While the mobile industry generally talks about 5G and sometimes 4G, there is also Wi-Fi, which plays an important role in many cases. Then there is fixed line, mostly fiber, that again has an important role to play. Finally, I am hoping that satellite connectivity will soon have an important role to play as well. Let's start by looking at NTT Docomo's 5G Mobile Smart Cyber Operating Theatre or 5G SCOT. SCOT is a fully networked, futuristic, smart robot-assisted surgical theatre with real-time monitoring and display of a patient's condition during surgery. Even though we can include the 5G element in here, it relies more on fiber connectivity. Many of the equipment might be connected over Wi-Fi if reliability is not critical, otherwise it would be connected via an Ethernet cable. Like it or not, China has probably the most advanced 5G network with many different use cases. This is mainly because 5G rollout and use has been a government-driven policy. 5G is helping doctors in rural China take help of specialists in the city to help advise during complicated medical operations. What I am unable to understand is why these hospitals haven't been able to get high capacity fiber on their premises and instead relying on 5G. The higher frequencies used in 5G also do not penetrate from outside to inside. So this means that small cells or some kind of infrastructure would need to be used indoors. This may just complicate upgrades and replacements. This is OnMed telemedicine station that can be used in malls, train stations, or even in remote area. Depending on the location, there may be a need for different kind of connectivity. If it was deployed in a remote beauty spot or some mountain peak, satellite connectivity may be the only option to provide real-time communication. During the early days of COVID-19 pandemic, a report by Vodafone UK was published on how to make hospitals safer to avoid transmission of the virus. Lots of suggestions as you can see in the picture, and I encourage you to read the report. The slides will be available on SlideShare and our 3G 4G channel. Again, worth noting here that it will not all be cellular or 5G connections, but there will be need for fiber and even Wi-Fi. If this hospital is in remote location, then satellite connectivity may be the backup option. Satellite Applications Catapult in UK is working on combining terrestrial communication networks like 4G and 5G with satellite communication networks to make connectivity ubiquitous and reliable. The Connected Ambulance project that they have been running allows healthcare providers to test technologies like remote ECG machine in a real-world environment. Let us now look at devices. Here I am going to point out in advance that the healthcare feature on most devices are independent of the connectivity technology. Let's start with Google. They have just launched their first Pixel Watch. It brings health and fitness features from Fitbit that Google acquired back in January 2021. As you can see, it will allow accurate heart rate tracking, fall detection, blood oxygen, etc. Similar sensors and health features are present in Samsung Galaxy Watch 5. It can track blood oxygen, heart rate, sleep cycles, body composition, workouts, and more. According to Samsung, the infrared temperature sensor in the watch provides much more accurate readings even if the temperature around you changes, so you can feel more empowered to take control of your health. Basal body temperature feature can also help women who are trying to conceive. There are also less well-known brands like Amazfit GTS 2E that are designed with long battery life in mind. They can still do some amazing health tracking, including stress level detection. Then of course, no discussion can be complete without talking about Apple Watch. It has similar sensors to other watches we looked at, but it provides a much more comprehensive experience, and that is why people swear by it. When you hear about a wearable that has saved life, it's generally always Apple Watch. You can say this is mainly because most smartwatches are Apple Watch. In fact, Apple just crossed 200 million unit shipment recently according to Counterpoint Research. Nevertheless, it's amazing how wearable are saving lives and have the potential to save many more lives in the future. Smartwatches are also useful to warn us that baby is crying loudly and it can cause temporary hearing loss. Many of the components that became cheap due to economy of scale of smartphones and smartwatches are now even being used for dedicated digital health solutions. In fact, they are not even relying on cellular communication, but using unlicensed technology like LoRaWAN. The proliferation of these devices will in turn increase innovation and reduce the cost further. It will be a win-win scenario for component and device manufacturers as well as consumers. In fact, it's not just wearables where all the innovation is happening. A 5G connected diagnostics tool called TechieHub provides high-resolution photography, video, thermometer readings, and octoscope readings as well as portable ECG and spirometry data. This makes it possible for patients to receive full examination as their GP receives the patient's clinical information in real time from the device operated by staff at 5 local care homes. West Midlands 5G has a good write-up on this. The link is in the slides. Let's now quickly touch on the network side. With technology advancing, networks are getting smaller and easier to deploy, operate and maintain. This is one of the reasons that there are quite a few trials of private networks in hospitals. The example here is from South London, where the business division of operator Virgin Media O2 is working with Nokia to power UK's first 5G connected hospital. The trials are investigating the efficiency, safety and security benefits of using smart 5G connected technologies in NHS hospitals, including IoT, augmented reality, and artificial intelligence. This is another slide from Vodafone, where they foresee a lot of use cases with private networks in hospitals. On the 3G 4G blog, I posted a talk from CIO of CHUK Medical Center in Hong Kong. They foresee 5G private network for smart care, smart medicine, and smart management using Internet of Things. I encourage you to listen to that talk. Finally, let's look at applications. You have to remember that we are talking about over-the-top applications. They may work on your smartphones, smartwatches, or other smart devices, but they are not tied to your network or connectivity. They can run equally well using Wi-Fi, 4G, and even any other connectivity. This is a good picture categorizing different healthcare apps. It clearly shows which apps could be used by the medical staff and which ones can be used by the patients. This is a real-world categorization of mHealth apps for patients or end users from China. As you can see, the users have doctor apps for obtaining health knowledge or services, health consultation, offline booking, or live streaming consultation, and much more. A lot of these apps don't need to be real time. In this final slide of the presentation, let's look at some of the statistics from the analyst firm STL Partners. While they are focusing on 5G, these numbers reflect how connectivity can help more people get treated and less people miss appointments. As we looked earlier, the number of visits by experienced professionals can reduce as they are able to provide guidance remotely. Connectivity combined with advances in networks, devices and applications is going to improve the healthcare sector significantly in the coming years. Here are some further reading links for anyone interested in researching this topic further. I hope I was able to do justice to this topic in this short presentation. This is a huge topic area, so I encourage you to continue exploring. Happy to hear your thoughts, feedback, or any comments and suggestions in general. Thank you for listening and see you again soon. Goodbye.